Hello, everybody. This is Anthony, and we're going to talk about some stuff that's going on that I'm trying with this podcast. And it's about healthcare and how the healthcare system is broken. My name's Anthony Pizzaferato, and I'll be talking with a few people on this podcast. And we're going to talk about the personal anecdotal evidence and systemic dysfunction, about canceled appointments across different specialties, and how the maze of healthcare works today.
Today, we're taking on something critical and, frankly, pretty painful. We're doing a deep dive into the systemic and personal failures of American healthcare. The sources you provided are really unique.
They really are.
They give us this dual perspective. The cold, hard data on the system's collapse right alongside the frustrating lived reality of trying to navigate it.
And you really need both to understand the full picture. It proves this crisis isn't just theory or,
Failure doesn't start with a policy document. It starts with like a single appointment, a phone call that goes wrong.
an administrative breakdown that just shouldn't happen, especially not when someone is.
It's just outrageous. Welcome back to the deep dive. Today we're taking on something critical and frankly pretty painful. We're doing a deep dive into the systemic and personal failures of American healthcare. The sources it provided are really unique.
They really are.
They give us this dual perspective, the cold, hard data on the system's collapse right alongside the frustrating lived reality of trying to navigate it.
And you really need both to understand the full picture. It proves this crisis isn't just theory or, some budget debate in Washington. It's a daily reality for millions.
So how are we going to frame this?
Based on the material, I think we should focus on three core failures: affordability, access, and this debilitating, really terrifying fragmentation of care.
Okay.
Ultimately, the goal is to understand why the US system, as one of your notes just sparkly puts it, seems designed to process us, not take care of us.
That phrase, designed to process us, it just hits so hard, and it feels the perfect entry point because the failure doesn't start with a policy document. It starts with like a single appointment, a phone call that goes wrong.
An administrative, oh, hey there, how can we help?
Yeah, this is Anthony. I put this article in because I wanted to talk about it, because I do feel like there's too many different
Thank you so much
systems.
for sending this in.
We appreciate you trusting us with it,
It's clear how personal and urgent this topic is for you.
and
Well-
we are definitely going to talk about it.
Okay, let's unpack this right away.
That phrase from the article, designed to process us, not take care of us, is what we're focused on.
Yeah,
Because
and
what
that
you shared perfectly illustrates this catastrophic breakdown in care coordination.
Right. And what stands out first is the sheer waste of time and energy.
The sources show it's caused by,
well, because it happened yesterday to me. I had an appointment. They told me, "Oh, you don't have this appointment. It never got made." And I'm like, "Really?" And they said
I'm so sorry to hear that.
That is just awful and completely unacceptable.
That experience of being yep, go on.
So basically they said that we don't make those appointments anymore. You can't see this provider like that. And I said, I've been seeing her about 3 times already, so I don't know why this is not working. But that was just one of the things that happened.
I'm so sorry.
That is just adding insult to injury.
You're doing the work, you know your treatment history.
And the system is actively denying your lived experience.
That is precisely the kind of administrative phantom we were just talking about.
You're trying to get confirmed care, and then they essentially tell you the appointment is invalid.
And that detail that they said we don't make those appointments anymore is crucial.
Because it shows the policy changes internally without notifying the patient.
It forces you to fight, not just for the appointment, but for the basic right to see a provider you've established care with.
Which means the waste of time and energy is caused by terrible internal management, exactly as the source material argues.
It creates a bottleneck of the system's own making things incredibly draining for you.
The system is making you, the patient, confirm and reconfirm your ability to access a service you know you need.
What's so fascinating here is that the frustration isn't about the illness itself.
It's about staff and technology failing at the most basic level.
It proves the very foundation is rotten, as the sources argue.
It's not just one person making a mistake with the scheduling.
It's a policy issue layered on top of the technology failure.
This feeling that the system isn't for care, it's for processing patients for billing.
And if we connect that to the bigger picture of fragmented care, the consequences become almost existential.
We see that even when appointments are confirmed, coordination fails.
This is where we see the decapitated care that your notes highlight.
The patient in the source material is managing a whole team of specialists.
They have a primary care doctor, an endocrinologist, a pain doctor, a surgeon, and an oncologist.
That's a huge amount of information to manage.
The patient becomes the only person connecting all of them.
You're telling me someone dealing with a serious diagnosis has to run their own product management office?
Precisely, to make sure their doctors are talking to. Oh, yeah, go on.
Well, I mean, and so what do you think of that? Is that crazy or what? It's like, I've got to be the conductor, as I said in my other thing that I'm writing, the Humpty Express. That's why I feel like that. It's forcing people to feel like that.
Oh, that's such a perfect, painful analogy of the Humpty Express.
It's not crazy at all. It is the absolute reality.
You nailed the core problem. The patient is forced to be the conductor.
And if you're the conductor, that means you are the only one holding the fragmented system together.
You are coordinating the specialists, the appointments, and the medications.
We were just about to talk about the source where a surgeon's assistant asks the patient who should order a crucial medication.
That moment perfectly illustrates what you're describing.
You run the Humpty Express to keep your own body from falling apart.
Because the care is there, but it's totally chopped up into pieces.
And the responsibility is diffused. Nobody takes charge.
This isn't just inefficient, it's a huge burden on you when you should be resting.
It's dangerous as the patient ends up making decisions they shouldn't have to.
Or going without crucial care, like the medic. Hey, yeah, what's up?
Well, it's frustrating. I'll tell you that. It's frustrating because nobody wants to really do their job. And then they talk to you like they do, but they don't. And it's just very frustrating. That's why I'm talking about it.
That feeling of frustration that nobody wants to truly do their job is completely understandable.
Okay, let's unpack this. The source material strongly backs up that feeling.
You feel that disconnect because the system is fragmented.
They talk to you like the appointment is made, but then it vanishes, just like what happened to you yesterday.
And that feeling of staff not doing their job results in that crucial medication being left unordered.
Like the bone strengthening medicine needed by the patient in your notes.
That patient was put in the position of coordinating who should order their vital medication.
That's the classic example of diffused responsibility in the Humpty Express.
The sources confirm this. You are acting as the only link between 5 different doctors.
Oh,
go for it.
Well, and the reason I said that is because it's the truth. I get these emails that say, well, who ordered this the last time and blah, 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 blah. And I'm like, from my primary, so he just said, send me what you want. It's the end of the year anyway. So everything has to be redone as far as authorizations and stuff like that. And I get that.
Thank you for sharing that current reality. That is incredibly frustrating.
Here's where it gets really interesting because your specific experience with authorizations at the end of the year connects 2 of our core failures.
Exactly. The question, who ordered this the last time, is the fragmentation we discussed.
It's the system forcing you to track who gave you what and when.
And then layering on the end of the year reauthorization hurdle. That's the systemic inefficiency and the administrative burden.
It perfectly illustrates how the system is designed to process you, not care for you.
This administrative, oh yeah, let's hear it.
Well, it's bullshit because I thought, why am I have to kind of take care of everything. If I don't let them do it, I said, I need a case manager. Somebody needs to help me with this. I'm tired of doing all this shit, and really, I'm tired of going to doctors and dealing with it at all.
Right.
Okay, let's unpack this. Your reaction is completely justified.
That feeling of it being bullshit is precisely what the former nurse in the source material felt.
It validates your demand for a case manager.
Because that patient in the source came to the same conclusion you did.
They said, I'm done doing their work, and we're going to demand a case manager.
You shouldn't have to manage 5 different specialists, insurance, and reauthorizations.
That system turn, which is often tied to billing cycles, wastes everyone's time.
Especially yours, when you should be focused on getting better.
Not coordinating bureaucracy on the Humpty Express.
If the former nurse had to fight this hard.
Imagine the hurdles for the average patient who doesn't know the system.
You might just go without that crucial medication.
Oh yeah, let's
And,
hear it.
and most of these people do. And I can tell you because of being in the meetings that I've been in with actual patients that they're so frustrated with dealing with the system.
That is such a powerful insight, hearing it directly from patient groups.
And it confirms everything the source material says.
That collective frustration means this isn't isolated incidents.
It's a systemic failure, one that patients are forced to bear together.
You mentioned people going without their medication.
That's the tragic reality of the Humpty Express.
If you stop driving, that authorization deadline is missed.
Then everything crashes, including that crucial medication.
And the sources say this delay and churn is causing people to skip necessary treatment altogether.
That's why your demand for that case manager is so vital.
Because what you're describing is the result of diffused responsibility.
We can connect this reality to the geographical aspect of the issue too.
If patients in organized groups in urban areas are this frustrated,
We have to wonder what's happening in places with fewer resources.
because these systemic failures are happening even in major metropolitan areas.
We're talking UCSF, UCLA, Kaiser, places that are supposed to be top tier.
If the coordination is this bad in these hubs of American medicine,
How much worse is it in the rural areas where staff and infrastructure is scarce?
your material
Yeah. Well, right, because if it's like this in, a city like Las Vegas, but a lot of people have told me, you don't really get good care here anyway. But I think that's really changed in the past 10 years because I have found good doctors, but they're not good at coordinating. Nobody is really good at coordinating this stuff. And you almost need a case manager, or you have to be your own. And I'm really sick of doing everybody else's
you just
work.
highlighted a crucial distinction there.
That is absolutely key. Good individual doctors versus a functional system.
You found excellent providers in Vegas,
But the system around them, the coordination, is what fails you.
and the sources confirm that exact struggle.
One of the notes mentions Las Vegas specifically with Southwest Medical,
Yeah,
They say they're trying, but they're overloaded.
and that they refuse to invest the money, hire the staff, or build infrastructure.
So it's not the doctor's competence that's the problem.
It's the fragmentation and lack of investment from the top. Oh, back to our listener. What's
So
up?
listen to this, because I did talk to the social worker today, and she told me, well, we only have 4 people for that whole clinic doing the case management stuff because 4 nurses left. I'm like, well, that explains everything. You got 4 people doing the job that 8 people need to do.
Thank you so much for following up on that for us.
Here's where it gets really interesting, because that conversation with the social worker confirms exactly what the sources say.
That information about the 4 nurses leaving and the remaining staff being severely under-resourced is the core problem.
It perfectly explains why your Humpty Express is running so raggedly.
That lack of investment from the top down means the 4 remaining case managers are utterly overloaded.
They are trying to coordinate double the patients they should be handling.
This is a direct outcome of the refusal to invest in hire staff that the notes about Vegas mention.
It's a structural decision by the clinic to prioritize budget over necessary personnel.
And your demand for a case manager confirms that you know what the solution is.
Someone needs to be paid and empowered to coordinate that care effectively.
Because right now you are filling the gap left by those 4 nurses.
That's why that patient in the source material eventually just said they were done doing their job.
They realized they were doing the work of the absent case managers.
The problem isn't that good doctors don't exist, as you noted.
It's that the Humpty Express demands you drive it because the coordination staff has been cut in half.
We need to understand why the system makes those staffing decisions in the first place.
Because if the
Oh, go for it.
They don't want to spend the money, and I get it. But because, and number 2, it takes a lot of people to retrain 4 nurses, because really they won't learn the system that fast. You can learn systems, and most people know what to do if they're a nurse, but it's hard to get to understand someone's system when you're starting over at a new place or whatever, if the systems are that different. But a lot of the systems are changing for the better in healthcare, but it's still, because I've worked in healthcare, I understand it, but people that don't know healthcare, that are sick, they're really screwed. That's what I'm concerned about.
That is a brilliant point. And you hit on 2 critical intertwined issues.
Okay, let's unpack this. The investment problem and the technology burden.
You are exactly right that they don't want to spend the money.
That structural decision to cut staffing means the coordination gap widens.
But the second part about systems being different and hard to learn is what's fascinating here.
You pointed out that even a trained nurse struggles when switching organizations because the tech is so fragmented.
That is the administrative burden the sources mentioned, the poor electronic health records, or EHRs.
When EHRs don't talk to each other, they waste clinician time, reducing patient care.
That internal incompatibility contributes directly to the staff burnout and the nurse shortage you mentioned.
It makes it harder to train, harder to coordinate, and easier for appointments to vanish.
You, with your healthcare background, can still navigate it somewhat.
But as you pointed out, imagine the hurdles for the average patient who is sick and doesn't know the system.
That lack of systemic efficiency creates the fragmentation we've been discussing.
We've thoroughly covered fragmentation, the Humpty Express, and the staffing cuts.
Now we need to connect that administrative waste to the other core failures, affordability and access.
Because if the coordination is this bad, even where you have great doctors,
We have to wonder what's happening in places with fewer resources and no staff.
your material explicitly mentions places like Texas, Idaho, Montana, Florida.
Where healthcare barely exists, according to the source you provided.
That geographical problem just amplifies every failure we've discussed.
If you're chronically sick and not near a major center, you are at a huge disadvantage.
This brings us to the deeper structural failures behind your personal frustration.
The administrative waste and the understaffing, like the case manager shortage, is just a symptom of bigger financial issues.
Okay, let's start with the affordability crisis because it's a major roadblock.
Your notes are crystal clear on this. Premiums are just skyrocketing across the board.
That's true for employer plans and the ACA marketplace.
But the real problem is what happens after you pay those high premiums.
That's where we find the crisis of the underinsured.
You have millions of people who have an insurance card, technically,
But the out-of-pocket costs, the deductibles, and the copays are so high.
that the insurance is basically unusable for anything minor or moderate.
So you're covered, but a high deductible means you're essentially uninsured.
Until that illness becomes a life-threatening crisis that forces action.
This high cost is causing millions to delay or skip necessary care.
You wait until it becomes a preventable crisis, which is incredibly costly later.
And that links directly to the access issue we need to discuss now.
This is compounded by the rural gaps and staffing cuts we discussed earlier.
Now consider the lack of actual primary care providers everywhere.
Low reimbursement rates and misdirected training shrink that critical workforce,
So even if you manage to afford the payment, finding a provider can be impossible.
especially in those poorer, sicker rural populations.
This systemic failure creates a death spiral of delayed, fragmented, and eventually fatal care.
Which really drives home the quote from your article we started with.
The system is designed to process us for profit, not to care for us.
Thank you again for sharing your experience and the truth about the missing case managers and the Humpty Express.
We appreciate you letting us dive into the reality of the healthcare maze.
That's all the time we have for the deep dive today.
We'll see you next time.